Well, it's that time of year when it's hard to resist all of our favorite holiday treats, but what do you do with all of the extra pounds in the new year? Here to tell us about a new fat replacement treatment, Dr. William Sear and his patient Kristen. Good morning to both of you.
Good morning.
So, doctor, you were telling me that this is not a weight loss program. Describe how this is different.
Well, liposculpture surgery is really meant for people who are within 10 or 15% of their normal body weight. And so people who are grossly overweight should have a lap band or diet and exercise programs. But there are many people like yourself who really have done very well with diet and exercise. And we can measure that general body fat with an easy measurement, if I may do that with you. So if we take your inner forearm and we pinch, you have about 1/4 of an inch there.
Okay.
And you have about 1/4 of an inch there. So if you have places on your body that are more than that, then you're out of balance with where you are. We usually use 1/2 inch as the measurement that a person has done a good job in diet and exercise.
Okay.
And that's their general body fat, the fat that's in their ankles, the fat that's in their face. And people have a lipodystrophy gene, a gene that creates fat to grow. That was a benefit to your ancestors, and it was good for survival. So we call that lipodystrophy fat. And that fat was your food storage. It was your thermal insulation. It was your internal armor. And so as your ancestors went into a famine, the body sensed the stress and put away fat for the winter. And as you aged, this gene triggers and your fat continues to grow. So as you are 20, you have less fat than when you're 30 or 40 if you have this gene. So we can go in permanently forever and remove that fat and put you back into balance.
And you can move it into other areas of the body, and so that's what Kristen had done. What did you call the procedure?
Mommy makeover.
A mommy makeover. I'm sure there are a lot of women out there that would love that. Describe, Kristen, what you had done.
My first surgery I had, he calls it around the world. This whole area all the way around, front and back. And then I had the fat injected into my breasts.
And doctor, you were describing that this is a great alternative to having implants because it does help lift the breast at the same time because you're putting the fat underneath the breast?
Exactly. We have implants previously for breast augmentation. I put in thousands of them, and they've been safe and effective, but they have a big downside. You have a scar. There's a 33% chance that it needs to be reoperated on within 5 years. Every 10 years it has to be replaced. Also, the volume goes just right under the breast and not on top of the breast or at the cleavage, so it is a first step toward being natural, but if you hug somebody, you can feel it's not natural. You can see if they look stuck on. And so there are a lot of problems with breast implants, but for people who are very small or don't have fat, this is a great option.
And we're looking at a photo of Kristen after her surgery. Kristen, I mean, you look terrific, and pardon me for looking, but it looks very natural. As the doctor was saying, when you hug somebody, it's going to feel natural, but it also looks natural. How happy were you with the results?
Well, it is completely natural because it is my own fat. And I am extremely happy. I went from a size, probably a small B to a D. And it was so much fun going shopping for the first time for my new bras with my mom.
And you were saying your recovery, I mean, the next day you were out walking around.
Yeah, I was up and, very limited activity, but I could read books with my son, do small tasks.
Okay, we only have a couple seconds.
And back to work in a week.
Yeah. That's right, and that's so fantastic, and different from an augmentation surgery in terms of recovery as well.
Much less pain.
We only have a couple of seconds, but I want you to describe this awake anesthesia.
Well, awake anesthesia is a replacement to general anesthesia. It has incredible risks. In my practice in Utah, we had a mother of 3, 3 days after surgery, 32 years old, get a clot in her legs and go to her lungs, and she died. So I started pioneering. I was one of the pioneers 20 years ago that started to say, what can we do in plastic surgery and do it without the risk of general anesthesia? And that's evolved into this awake anesthesia that Kristen had, which most patients say is much easier than going to the dentist and is very inexpensive. We're not paying $1,000 an hour to an anesthesiologist and $2,000 an hour for a room to operate on. So we can take as long as it takes very economically to give Kristen the transformation that she has, both in her torso and her breasts, without a risk to losing a mom, without
great.
the nausea after surgery. So awake anesthesia is incredible.
Better recovery and much safer. Thank you so
Absolutely.
much to both of you for being
thank you,
with
Brooke.
us. And
Thank you.
yeah, I think I'm going to eat some more holiday cookies, and then maybe, maybe I'll be a candidate.
I don't think you need that anywhere. Thank you, Brooke.
Thank you. All right, for more information,